How much will healthcare cost in retirement? Well, the answer may surprise you. The numbers you see behind me are provided by a survey done by HealthView Services. Their aim was to find out how much does it cost to provide healthcare for a healthy 65-year-old couple from age 65 until they die. Here is the number for a healthy 65-year-old couple. That's just covering the Medicare Part B, Part D, and supplemental and dental insurance. The cost there is about $322,000 over their lifetime. But when we add in the cost of the copays, the deductibles, vision, and dental payments, the number actually goes up to about $404,000. So if you're getting ready to retire, that's a pretty big number that you have to plan for. So what does this number involve, and how can you reduce it if possible, or how can you plan around it? Well, first off, this figure here is just for the premiums themselves. So that's Medicare Part B, Part D, supplemental, and dental insurance. That doesn't include any out-of-pocket expenses. And many people overlook the fact that Medicare is going to have copays and deductibles. And so when we add in the copays and the deductibles, that's how we get to this number here, the $404,000. That number includes your copays, your deductibles, in addition to your vision insurance, which isn't provided by Medicare, and the copayments with your dental insurance. Now, mind you, I didn't mention any cost of long-term care. That's going to be a topic that we cover in a separate video. But I just wanted to make you aware of these two numbers because they're pretty large. What you need to do when you consider your healthcare costs in retirement is not just look at how much Medicare is going to cost. Instead, what you should do is actually incorporate the overall costs. And you want to incorporate your copays, your deductibles, your coinsurance. And you need to incorporate the fact that Medicare isn't going to cover everything. The supplemental insurance is used to help cover some of the expenses associated with Medicare, things that Medicare doesn't cover. You'll also want to have vision insurance, which isn't covered by Medicare, and dental, which again is not covered by Medicare. So you'll need supplemental policies or individual policies in order to cover those costs. You also have to consider that these costs are in today's dollars. So if you had a check that you could write for your overall medical expenses for the rest of your life in retirement, you could write a check for about $404,000 and cover it. But going forward, that number will grow, in fact, to about $607,000. So you're talking about $600,000 over the lifetime when we incorporate inflation. This is so important because right now your healthcare costs are increasing at about triple the rate of inflation. The figure provided by HealthView estimates that healthcare costs are rising at about 5.5% year over year. When we consider that that is such a great number, so much larger than the official CPI figure provided by the government, there's a lot that needs to be done for planning. So if you're getting ready to retire, you really want to have these two numbers in mind. You need to build a financial plan that has segmented your healthcare costs and has looked at your healthcare costs as a separate expense. When you do, you'll want to go a little bit more in detail and look at your Medicare premium costs, your copays, and your deductibles, and you'll want to incorporate your different premiums, including Medicare Part B and Part D. Beyond that, you'll also need to include an inflation rate that's higher than CPI. If you don't include a higher inflation rate here, then your plan is going to be a little misleading. Now, what else can you do besides planning? Well, a big thing that you could do today is make sure that you are using a health savings account. A health savings account is a special savings account used for health-related expenses. Now, in order to qualify for a health savings account, you do have to use have a high deductible health plan. So the first thing that you could do is to plan. The second thing that you could do is use an HSA. And what's great about a HSA is that you get triple tax benefits. You get a tax deduction for putting the money into the HSA. The gains in the account grow tax deferred, and then the distributions are paid out tax-free as long as they're used for qualified medical expenses. What's so great about an HSA is that you can accumulate money that rolls over year after year. So it's not like your flexible spending account where you use it or lose it. Instead, an HSA is going to allow you to build up a little nest egg. This is so great for retirement because over time, you can accumulate enough money to help cover your Medicare premium costs. And if you use your HSA to pay your premiums, then you're going to do so in a more tax efficient manner. Now, the final thing that you can do to help out with the medical costs today is to monitor your health. High blood pressure and type 2 diabetes were two of the medical ailments that were cited in the Health View report as being two of the causes for higher health expenses. Now, fortunately, both of those items can be controlled. So if you have a health plan in place that helps you monitor your blood pressure, you're taking the necessary precautions to hopefully reduce it, then that can lower your health costs over time. The second thing is type 2 diabetes. If you are taking good care of yourself by exercising and eating right, then you may be able to reduce the impact there. But by just doing these 3 steps, building a financial plan that incorporates your healthcare costs as a separate expense, using a health savings account to accumulate some money as a separate savings for health expenses in retirement, and monitoring your health, you're going to put yourself on a better track for success in retirement, so that even if the overall costs of your healthcare expenses are about $400,000, it's not going to impact your ability to get access to great healthcare and to, more importantly, enjoy your retirement. If you found this video helpful, I'd really appreciate a thumbs up or any comments below. If you want help with building a comprehensive retirement plan, then click the link below. On the link below, you'll find a free training that I've put together to help you build an overall retirement plan so that you can have a successful retirement. I hope you find it helpful, and I look forward to speaking with you soon.